Hey mamas, welcome to Breastfeeding Relief with Bethany. We share incredible stories, tips, and breastfeeding ideas to help on your journey. I'm your host, Bethany Laverne, a lactation consultant and speech therapist who helps mamas with breastfeeding. Not all breastfeeding stories are the same, and we dive into those topics. Welcome, Kristen O'Dell, Newmommyguru. How are you?
I'm doing great, Bethany. Thank you so much for having me on today. This is so much fun.
Absolutely. We're so excited to have you. So why don't you tell us a little bit about yourself?
Sure. So I'm Kristen O'Dell, the Newmommyguru. I am a nurse practitioner with almost 20 years of experience working with pregnant women and their newborns. I have a lot of experience working in NICUs and in well baby nurseries. And I'm also a mother of 3 young boys, married to my high school sweetheart. And together we have a small motel and an ice cream shop that we operate seasonally. So we keep very busy with all that going on. And my passion is to really help pregnant women and postpartum women prevent or treat postpartum mental illness. And I feel like that's better done by better preparing and education. A lot of women are not fully prepared for what's going to happen in the 4th trimester. Mm-hmm. And so I usually see them in the 4th trimester, and I feel like we could do a better job as providers preparing our pregnant women for what the 4th trimester is like, especially breastfeeding. That is a very big part of the 4th trimester. So I love pre-birth education, but then also post-birth and 4th trimester support. So I do help new moms who are breastfeeding or bottle feeding transition into that time with how to care for their bodies, how to do feeding, how to get into sleep routines, and all kinds of things like that, because there just is such very little support for women in that 4th trimester, which is the 3 to 4 months after you give birth. Many times you see a provider like your OB like 6 weeks after, but many women just skip that appointment and don't even go to it. It's like a huge amount. It's like 40 to 50% of women don't even go to their 6-week postpartum appointment. And we're sent home with these babies and the support isn't there for us like it once was. Our mothers and sisters don't always live down the street from us like they did 70 years ago. And many of us are returning back to work and there's a lot of pressure. And so the support isn't there. And I want to bridge that gap for postpartum women. So that's what I do and who I am.
That's amazing. Well, thank you for all you do. That's awesome. So as all of my mamas know that listen regularly, I call myself the tongue tie expert with lactation and speech. And so we were chatting a little bit before, and she shared with me about her son's tongue tie. So why don't you tell us a little bit about that journey with your boys?
Yes. So as a provider, I've been doing this for about 18 years, but really tongue tie diagnoses and treatment with surgery is kind of relatively new in medicine. Ties have probably always been there, but we never realized how much of an issue they were. And back before the 90s, we weren't really breastfeeding as much. There wasn't a push for breastfeeding. So people probably had tongue ties, but they weren't really presenting as much of an issue until maybe they had speech issues later on. And now we are recognizing it more in newborns, especially when they're having breastfeeding or latching issues. But it's crazy how little people are trained in this and how to recognize it. I work in multiple hospitals, and you'll see that in some of my hospitals, nobody's ever diagnosed with ankylglossia, which is a tongue tie. And that's because nobody knows how to. Nobody knows what to recognize. They're not looking for it. They're not speaking to the moms about how the breastfeeding journey is going, about how the latch is going. And so I'll see no babies. And then another hospital I work in, multiple providers are very well trained in recognizing it. And we see that diagnosis a lot. So it's really interesting from place to place or from region to region where you go, how these things are picked up or missed, maybe, depending on people's experience or education on the issue. On a personal level, I had 3 children with tongue tie. My oldest is now 9. So 9 years ago, ankylglossia and revision surgery were kind of new. Mm-hmm. Even I, doing what I do, working with babies, was really just starting to learn about it and still wasn't even sure how to diagnose it. And so I really diagnosed my son later on. He had a lot of feeding issues. We were able to push through using a nipple shield to help us with latch. but it wasn't until later that I realized he had a tongue tie, but he never had the revision surgery. We were just able to kind of get through. And luckily we didn't have any speech problems. I would kind of grade his on like a 2 out of 4 as far as severity. So we were able to kind of get through, and many babies with that type of severity are able to get through, and sometimes they aren't. But that's sort of one of those middle of the road kind of ankylosing diagnosis. My second child was born only at 5 pounds. So he was on the smaller end of size for his body and his mouth. I have larger breasts, so it wasn't really quite a good puzzle fit there for his mouth. And you throw in, he had a very tight tie. His is what I would grade a 3 to a 4 with how tight his tie was. And I did actually, by that point, I was more educated in the diagnosis and in the treatment. And I brought him immediately the day after we were discharged from the hospital, right to a very well-known surgeon in the area to do that procedure. Dr. Cutlow is in Albany, and he is very well known in our area for doing it. In fact, he's probably one of the top 3 in the country to do that surgery. And he teaches many other people, other physicians and ENTs and dentists how to do that procedure. So I was able to get an appointment the next day, take him there. And it was night and day feeding him after that. We had a very successful breastfeeding story. And then my third was also born with a tongue tie, but again, was very similar to his older brothers, where it was like a level 2, and we were able to go with the nipple shield. And so I didn't revise them. But having my own experiences with these ankylosing and these tighter ties versus moderate ties, it gave me a lot of personal perspective, as well as the professional training that I had to really help other moms diagnose it, treat it, make a decision on whether or not they needed to take it to the next step and see a specialist or not. And so I often draw from that personal experience and share it with my patients too, so they know that they're not the only ones going through something like this. And many have done it before as well. It helps them not feel so alone in that. And many women have never even heard of this as a possibility. So it can be shocking and upsetting to hear that maybe your child needs surgery right away. And it sounds so scary. But being able to share my own experiences with them on the surgery, how it went, what it looked like, how fast the baby recovered, that always helped them feel a lot more ready to face it. And they have that support from me too. So
I just love that story. And I feel like that's why I connect with our mamas so well, since we have also been through that journey with my second son, and how awful it went the first time and how much better it went the second time. And so really talking about the importance of stretches specifically. I was not taught stretches. No one ever followed up with me again. I was shocked. No one even called me to see how it was going again. So I know the mamas are connecting with you well, because you have also that experience. That's wonderful.
Yeah. A lot of doctors don't do that teaching afterward, shockingly. I was lucky enough, and Dr. Cutlow had been so good at his craft and probably had been doing it for so long, since he was one of the earlier ones to be doing this surgery. He's a pediatric dentist, by the way. That he probably learned from trial and error, that he probably saw patients come back for a revision and realized that there's more that can be done. And probably through trial and error, he realized there needed to be exercises. So he actually uses clove oil on the babies before he does the surgery, and then afterwards as well. I use it a little bit just to help numb, for pain. Sometimes some doctors will recommend that for teething too. So that's what he recommends. And we did that a little bit. I usually maybe for like a day or two. And then we did the exercises with the tongue and the bottom of the mouth and, sucking exercises, and for about a week or so. And I was lucky that my child didn't need a revision after that. But I always do stress to my patients, if you're going to have the surgery, make sure you ask and understand what the exercises are that you need to do at home. Make sure you understand how often they need to be done, how it looks when you do it, and what to return for. Most of these pediatric dentists or ENTs or anyone who does the surgery, they just do it and that's it. They very rarely follow up. It would be a great idea to follow up to make sure that everything's healing well. It is a surgery, right? But for some reason, they're just not given a follow-up appointment. Sometimes my moms are relieved at that, because it's a lot getting a baby out to an appointment. And so usually they're happy to hear it's just a one and done kind of stop. And they don't need to, they usually want to go with their partner. So then their partner doesn't have to take another day off of work and they don't have to go together. So it's sometimes a relief to have it as a one and done appointment, but it's really good for moms to understand what to look for, what's normal, what's not normal. So they know, hey, this is not normal. We need to come back for a follow-up appointment. Maybe there's an infection. Maybe there's, it's cut uneven. Maybe there's a reanastomosis, which is when it can grow back together and may need to be cut again. And so it's important that when moms are having these procedures done on their babies, that they don't just, like surrender to the person doing it. They need to be educated in what's happening, what to look for, what's normal, what's not, so that they can advocate for their baby, because moms and parents, both parents, are the best advocates for the babies. So if they don't know what to look for, they don't know what to advocate for. So make sure you educate yourself, either, online, if you can find it. It's pretty sparse online for this topic, but if you have a good provider who's doing the surgery for you and will take the extra couple minutes, or their nurse, make sure you write it down, what those exercises are and what you're looking for, so that you're ready if something is not, typical.
Yeah. I love that. Yeah. And you've just kind of described my platform very perfectly. So thank you for that. So I'm trying to help mamas, understand what the whole team approach looks like, specifically, also seeing lactation so that your breastfeeding journey goes well. Cause of course we really want you to succeed with that. I know a lot of mamas walk in that they want to breastfeed and they feel like, I have to give up because my baby's not gaining weight. They're in the 0 percentile. I'm told I have to give up, or they start pumping, which is completely fine. But then they're like, I'm tied to the wall. I don't want to be tied to a wall. I don't want to be tied to the couch. I don't feel like I can hold my baby. And I've also come up with a lot of resources myself, with tracking those exercises. I'm a huge proponent to make sure you are doing all of those exercises. And so you can download my freebie there, with tracking those exercises. But I want to come along, and also support those mamas. And of course you can always do it digitally with me, so you don't have to leave, your couch. But the one thing I love with the follow-up appointments that your pediatric dentist really should be doing is also going in and stretching them again. And I call that like a deeper stretch, specifically because sometimes as moms, I was there. It's hard to do the stretches because they're crying. I don't know if you felt like that too, Kristen. And so sometimes I'm crying, they're crying, we're all crying together and doing the stretches. And you feel awful as a mom. At least I did.
That's a great point, and I totally am there with you. I hated doing the stretches, and I know the benefit of them. So I know how difficult it is for me. So I can imagine how difficult it is for another mom who may see, hey, everything looks like it's better now, and don't maybe understand the benefit of doing it, or don't really understand that if they don't do it, they might have to be doing this all over again.
Yeah.
But yes, it's very important. It's no fun. You know what I tell my patients for a crying baby? Is babies can't talk. We all know this, right? But how many times a day do we talk? How often do we talk to each other? We talk to each other over meals, in the car, getting dressed in the morning. Constantly we're talking. Babies can't talk. Their way of talking is crying. So you have to reframe that cry sometimes as them saying, oh, that hurts. So they're having a word, they're speaking to you. So you have to change that cry into a word, because sometimes the cry is what panics you, and nobody likes to hear the baby cry. But it's normal for them to cry. That's how they communicate. So if you think of it as more of a normal way of communication rather than a stressful action that's going on that you have to stop immediately. I mean, we don't immediately stop everybody else for talking to us, so that's them talking to us. So sometimes it's okay for them to cry, and it's them telling us something. So you want to try to figure out what they're communicating. Obviously, if we're doing exercises, it may be uncomfortable. I don't think it's incredibly painful. It's just they just don't like it. It's just like they don't like us changing their diaper. It may hurt a little bit, but I don't think it's incredibly painful. I think it's just more annoying, and they don't want to be messed with in that way. But we do have to push through and do it and stick with it, because in the end, if we don't, there may be more crying on the back end that we're going to have to deal with. So try to think about it that way. You're preventing further pain in the future, and trying to just allow them to talk to you while you're doing it.
There you go. I also tell mamas, the first 3 days are going to be the hardest, is how I felt. So I tell mamas, you need to take a nursing vacation. right? You need help when you know it's going to happen. You need help. So if you have another toddler at home or another child at home, if your partner can take off, if your mom can come over, if your sister-in-law can come over, get some help, and then just take a nursing vacation. And so every time after you do the stretches, do skin to skin, get them close to you, get the snuggles, and they are going to use you as pacifier mom because it's comfortable for them. They're comforted. It's soothing for them. And it's also good for them. The milk's giving them that extra nutrition. Another one, I'll give you some secret sauce right now. One of my biggest thing is to take some pump breast milk and freeze it, and then take those out. And I like those little munchie bags, which are really safe for our little ones. And so the coldness you can give to them, if you're tired of being a pacifier, the coldness you can give to them. And so it's going to numb their lip and tongue just a little bit for them. And you're also hydrating them. That's one of the biggest tips I give to my moms.
I love that. That's such a great tip. Definitely. I don't even have a better one than that. I'm going to use that for my patients now.
Good. All right. So you said in the hospital, you refer a lot to our pediatric dentist in your area. So why don't you tell a mama what a referral should look like?
Sure. So in our hospital, we actually have a list that we hand out to parents, and it has pediatric dentists and ENTs on it, all who perform the ankle glossia revision surgery. We give that to parents so that they can choose who they want to see. They can talk to friends, family. They can see who takes their insurance. So we kind of have a whole sheet we give out to them, which is great. Some hospitals don't have any references at all, and you're kind of left to your own to figure it out. But in my hospital, we have that. And I usually tell my moms to try to get an appointment immediately, like the day they leave the hospital or the next day. Most of these places will get you in very quickly around us because they understand the urgency of not being able to feed your baby, yet needing to do so 8 times a day. And if they can't see you for a day, that's 8 stressful feeds that you're pushing through, or having pain, or having to pump and not getting that breastfeed, which can also impact your milk supply. And so they understand the urgency. So many of our providers will get our moms in within a day or 2 of being discharged from the hospital, which is great. But I do stress that my mom's going home. If you can't, then you need to try somebody else, or you need to ask us to try to help advocate for a quicker appointment. But in the many years I've been doing this, I haven't had to do that. Mostly everybody's able to get in. And when you show up for I usually, my experience is my personal experience as a patient. And working with Dr. Kotlo, it was one appointment. We showed up, we were seen pretty quickly. And he asked me, you did an evaluation of the baby, took a look, agreed that it was a severe tie. In his case, he had a lip. Most babies who have a tongue tie also have a lip tie or need both revised. So he was having both. He uses a cauterizer, which is what I would suggest. I would suggest using that rather than scissors. So I already knew he uses that as his method. And he basically took the baby to a second room right next door to where I was sitting. It was like another exam room. And he did the procedure within about 5 minutes. The baby was back in my arms, and he asked me to sit there in that quiet room and breastfeed him and see how it went. So I was able to breastfeed him initially right after the surgery, and he was able to latch. It felt different. It felt better. It felt hopeful. It was up until that point I was really needing a nipple shield. And that time we were able to latch without it, but I did use it continuing a little bit just because I had some nipple damage. But we were able to latch and feed without it pretty much right away. And the pain was much, much less. It was very minimized from what it was in the hospital. And basically after that, he said, okay, great. You're having success with latch. You can go. He gave me, that's not true. Him and his nurse both went over the exercises with me right then and there. Made sure I understood what they were, made sure I repeated them back so that I could show them that I knew exactly what to do. And then off we went, and I did not have a follow-up appointment. Again, Dr. Kolo's an hour and a half from where I live. So I was actually one of those moms that was relieved to not have to come back, but had he asked, I would have. And then I was given clear instructions on when to come back if there was a problem, which I, going forward, luckily did not have an issue, and we never went back again. And that was the end. So honestly, it seems really scary when you're first told your baby may need surgery, but in most cases, it's a very minor surgery and it's very, very quick. It's not done under any anesthesia. You can talk to your provider about treating with Tylenol or any type of numbing. As far as I know, they just use clove oil on my babies, which was a very homeopathic way. There was no Novocaine or lidocaine or anything used. And I was fine with that. And the baby seemed fine when he was brought back to me. He was crying, but he was easily consolable. And that's what you want to see. So,
yeah. And I would say my situation was very similar. I did like that mine wanted me to nurse right away to see how that went. They had this cute little nursing room set up privately. And they said, you can stay as long as you want. And then they did come check on us once before we left, but it was nice that in a dentist office, there was a nursing room, which I thought was absolutely fantastic. And I know a lot of pediatric dentists now are having lactation consultants work in their office on the day they do releases. So they might do a whole bunch on Tuesdays and the lactation consultant's in there too. So then the lactation consultant sits in the room with you, which I absolutely love.
I think that's a great idea. We just had the doctor and his nurse.
Sure.
There was no lactation consultant with me. That was 6 years ago. So I'm actually really curious as to how Dr. Cutlow is doing it these days. I should probably go up and visit him and see how he's doing. But I think that's an excellent idea because if a woman is there with her baby for tongue-tie revision surgery, they probably are struggling with breastfeeding already and may not know what it feels like or looks like to have a good latch. And so having a lactation consultant there to guide and make sure things are going well before you go home is a really, really great plan. So I love that. That's great.
So you are known for the guzzle puzzle. Can you tell mamas what a guzzle puzzle is?
Absolutely. So most of my day is spent working with new moms right after they have their babies. So my job is to do exams on newborns in their rooms with their moms and see how things are going and see how breastfeeding is going. And I often find that new moms, especially moms who have never breastfed before, they're first-time moms or first-time breastfeeders, are incredibly overwhelmed with how breastfeeding is going. And they have this perception on how it should be. And many times it's fed to them by the media or a movie and babies come out and they go right on the breast and it's this beautiful natural thing. And that's how it should be for them, right? And they're very surprised to learn that that's really not what it's like at all. And nobody really prepares them for this ahead of time. But really, they need to learn it before they give birth because those first 24 to 48 hours of breastfeeding are really shocking, are not what you expect. And most of my moms are not prepared for it. So I usually explain that when babies are first born, they are wide awake. They're like, whoa, what just happened to me? I was born. And they're kind of mad about it, but they're wide awake. And many times that first latch, that first breastfeed goes really, really well because they're wide awake and they want to comfort themselves and they just know what to do and they latch. And moms get this like, oh, great, this is really easy. Baby latched on, no problem. And then what happens is the babies realize that they are so tired from being born because they think they did all the work. They forget, how much work the moms did. So even C-section babies, they're even more tired. So they decide they're going to have this very big sleep period and they're very, very tired after that first feed. And sometimes for the next 12 hours, it's difficult to wake them. And if they're a breastfeeding baby, they're supposed to be eating every 2 to 3 hours as a rule of thumb. Okay. Now, some of these times people really focus on, but it's a rule of thumb. There could be a little bit of wiggle room here and there, but about every 2 to 3 hours they should be eating. And if they're sleeping for 12 hours, they're going to miss, 3 to 4 feeds in that time if they're not waking up to eat them. And then after that 12 hours, they wake up and now they're mad about it because now they missed all these feeds and they're starving. So then they go through this big cluster feed period where they just want to eat and eat and eat. They're crying a lot because they realize they want to be back in the womb. There's no way they're going back in there. They just want to feel comforted and they want to feel in their nice tight womb and they're starving. So then they go on these cluster feed times where they're just eating sometimes for 4 to 6 hours straight. Every time you try to take them off, they want to go back on. This is that time when my new moms feel like they need to give formula because they feel like they're not giving enough. They feel like the baby just keeps wanting more. They feel like they're not making enough and something is wrong. And I have to tell them, wait, this is all very normal. Your baby slept through 3 or 4 feeds and is behind and is now trying to make up for that. And when the baby is latching on doing this cluster feed, and it's going on for quite a few hours, they're also releasing hormones in your body with all of that suckling that's going to help your milk come in. So while it's really hard to go through that cluster feed, you kind of just push through it. And the other side of things, your milk hopefully will come in and you'll get into a more of a routine. But here's the big thing. The guzzle puzzle basically means that when you give birth to your baby, it's like you have a puzzle and you just open the box by giving birth to the baby. And you're now shuffling around in your puzzle pieces and you realize that your box doesn't even have all the pieces in it that you need. Your puzzle pieces are the pieces that you need to breastfeed your baby. Okay. And your pieces aren't even in there because you don't even know what you need yet to feed your baby. All the breastfeeding classes that you could take and all the podcasts that we listen to and all the internet things that we read, none of them really prepare us for our puzzle. And the only one that can do your puzzle is you. You are going to be the one to figure out what pieces fit where in your puzzle for your baby. And your puzzle pieces that you're missing, they're going to come from all around you. They're going to come from your pediatrician. They're going to come from the lactation consultants that you're working with. They're going to come from your sister who breastfed 3 babies. They're going to come from your neighbor and everyone else who has an opinion about what you should do with breastfeeding. And many times they're really trying to help. They're trying to help you with a puzzle piece that worked for them. But their puzzle is not the same puzzle as yours. Everyone has their own puzzle to work on. And some pieces may be the same in each other's puzzles, but the end puzzle is always going to be different for each person. So you have to remember someone may be offering you a puzzle and it's okay to take it and try it in your puzzle. But if it's not working for you, it doesn't mean there's something wrong with you. It doesn't mean they gave you bad advice. It doesn't mean it's something you have to be upset about. It just wasn't a piece for your puzzle. But keep it nearby because you might use it later because breastfeeding is ever evolving. That puzzle is constantly being worked on and you might need that piece later on. So what I find is when women get contradictory advice, you'll hear people will tell you, don't use a pacifier. Someone will say, use a pacifier. Someone will say, don't ever use a nipple shield. And then someone's going to say, use one. It's the best thing ever. These are pieces that people have used that worked for them. And some of them really aren't right. And some of them really aren't wrong. There are ways that you can use these tools in the better ways. And there are ways you can use them maybe not so good for the baby. But if you know how to use these tools properly, they're a good piece of the puzzle, maybe. But if you're getting contradictory information from people, it can really stress out a new mom who isn't maybe so confident in what she's doing with her breastfeeding journey. And we don't want that to happen. Breastfeeding should really be a positive experience for you. If it's becoming a negative or stressful experience, you have to just take a step back, take a deep breath, grab a snack, drink some water, and just, start over again and work those puzzle pieces. But that puzzle will take at least a week to put together. It's going to be one of those 1,000 piece puzzles. Okay. It's going to take you at least a week. And some people, it may take up to a month to figure out your puzzle. In my case, it took me 3 to 4 weeks to figure out my puzzle for each one of my babies, mostly because we had tongue tie issues and latch issues that we had to work through. And my puzzle pieces, what worked for me was, using a nipple shield for all 3. But I have other people who tell me they never say use a nipple shield. For me, it worked. It was part of my puzzle piece. I often suggest it to other people, but I also tell them if it's not working, it's not your puzzle piece, then don't use it anymore. So I really think that new moms who are really learning how to implement breastfeeding, it's such a new thing. It's like learning a whole new skill. And there's nothing we've done in our lives that we learn on the first day. And we usually don't learn it in the second or third day. It takes us a long time to learn a new job. And breastfeeding is like our main job as a mom, if that's what your goal is to be exclusively breastfeeding. It's a full-time job. You're going to take 12 hours a day on average to breastfeed your baby. You're going to spend about 12 hours a day sitting and feeding that baby. And that does not count the time you spend pumping and washing pump parts. If you're a pumping mama, it's even more than 12 hours a day. And so that's your main full-time job. And we don't learn a job in a day or 2 or even a week. Sometimes it takes us a lot longer to learn our job. And so give yourself that grace and that time to figure it out as long as you're happy and the baby's fed. That's it. So sometimes a puzzle piece might be pumping and feeding a little bit of pump milk. Sometimes a puzzle piece is formula for a little while. Every journey and every puzzle is different. So don't make someone else's puzzle yours.
That is such great advice. I love that. So all of our mamas that come on the podcast, we always ask, what was your favorite breastfeeding product?
Yeah. For me, it's a nipple shield. It's the only thing that allowed me to be successful with my babies and feeding them. It's a great tool. And it's very cheap and inexpensive. And, keep in mind it's a piece. So some people may not like them, or some babies don't like the feel of silicone in their mouths, but it's a tool that many of my postpartum moms are not even aware exists out there for them. And so it's something I usually just say, get one and see. Don't buy 10 of them, buy one. And if it's working really well, then get a bunch, because usually they're clear and you literally put it right in front of you on the counter, and you're looking right at it and you can't see it because it's clear. So you lose them very easily. So if it becomes a tool that works for you, make sure you do get a couple of them. But I have to say that's probably one of my best breastfeeding tools. And my favorite pump was a Medela. I've used 3 or 4 different brands of pumps throughout my time, and I'm just a big sucker for a Medela. But that's another thing where that's different for each person. So that's something you just have to try. I mean, you could take the advice of a lactation consultant or a friend, but I've tried Medela Spectra. I've done the Willow, the hands-free pump one. I forget which other one I've used, but out of all of them, I love the Medela the best. So I love Medela products, and I like the nipple butter that they make, the lanolin that they make for nipples that get a little bit chewed up from mislatching. That's usually my favorite thing that I recommend. And that's it. I have other baby products. My top 2 baby products are a lighted nail clipper. They're actually sometimes hard to find. Sometimes you can find one on Amazon. Makes all the difference. I have so many moms that tell me they clip the tip of their baby's finger. It happens to everyone, all the best of us. But the best way to prevent it is use one that has the light at the end of it. And after you get good with it, you can even cut their nails when they're sleeping. You can sneak in there in the dark and you cut their nails in the dark. It's great. You can see what you're doing. They don't move at all. And it makes it easier that you don't snip the tip off, because usually you snip the tip off when they move on you. And so I like the lighted nail clipper for my new moms. And then my best diaper rash cream, which everyone has one, is called Calmoseptine. We use it in the NICU for babies who have severe diaper rash. And I've seen nothing heal a diaper rash quicker than Calmoseptine. So it's the one I always recommend to moms with a diaper rash. I don't recommend putting diaper rash cream on a baby all the time. I would only use it if you're seeing redness or seeing a rash. But Calmoseptine is one of those that will create a barrier, but also heal at the same time. Most other diaper rashes just create a barrier. They don't heal. So it could take 3 days for that to heal on its own. The Calmoseptine creates the barrier and heals, and you'll notice a difference in the diaper rash within the next diaper change. So that is a very fast one. As if you've ever had a baby with a diaper rash, you just feel the pain that they're going through, and it's so torturous. So that is another. Those are my 2 favorite things that I always recommend to any mom, new mom or repeat mom, to have in the house when you're having a newborn there. So
I love all those products. I like how you say, definitely, if you're using a nipple shield, please get more than one. I definitely was with a friend. She was using a nipple shield and it dropped on the ground and she just had one. And she was like, and I was like, I'll go wash it for you. I don't, yes. I'll just go wash it. I don't know.
I lost a few and I was so dependent on it, because don't forget, it was my tool. I was very dependent on a latch for my baby, and my baby really would not latch on without it. And that when I lost it, it was complete panic. Like, you only have minutes to find it before your baby's going to be screaming at the top of their head. So, and like literally my husband will pull them out of the couch because you'd set them next to you and it would fall and you'd never find it because it's clear. So I had to have like multiple ones in different places. So I always had one. I think they should make them fluorescent pink or fluorescent blue or some sort of bright color so that we could actually find them. I don't know why they're clear. One day I'm going to make one that's fluorescent pink, and I'm going to make, my millions, because having them clear, it makes no sense.
Perfect. You and me are going to make it together, and we're going to go on Shark Tank. So
that's it. I love it. Love it.
That's great. And lastly, how can all of our mamas connect with you?
Yeah, the easiest way to find me is you could check out my website. It's www.newmommyguru.com. And on there, you can find links to the courses that I offer to pregnant and postpartum women. I also have a support group called Beyond the Bump for women who are in the 4th trimester who need some support. We meet once a week. And you can find all my social links on my website as well. So make sure you connect with me. Send me a message on Facebook or Instagram. I love to hear from my pregnant and new mamas. And that's the best way. You can reach me through email that way too. So my website's the best way.
Awesome. Well, thank you so much for your time. I know all of our new mamas are going to want to connect with you.
I would love it. And thank you so much, Bethany. I appreciate you having me on today. This is so much fun. Thank you.
Thank you so much for listening in. If you loved this episode, it would mean so much if you would share it with another mama or post on social media and tag me. I want to personally thank you for wanting to help other mamas. You got this. I'm rooting for your breastfeeding journey.